Did you know that some medications we take regularly might be negatively affecting our memory? Studies show that memory loss is not solely a consequence of aging, but can also be triggered by external factors, such as the medications we use daily. Surprisingly, many of these substances are part of your routine without you realizing the risks. In this video, we will present the 8 most dangerous medications for your memory. Each one will be explained in detail, including how it affects your brain and what you can do to protect your cognitive health. The last medication on the list is especially alarming, as few people are aware of its side effects. Stay until the end to also discover the 5 essential strategies to preserve your memory and maintain a healthy brain. These simple steps can make a significant difference in your quality of life and mental longevity. Now let's explore the medications that can negatively impact your memory. It's important to understand their effects and consider safer alternatives for treating various conditions. 1. Amphetamines. Amphetamines temporarily increase alertness, but prolonged use can damage the brain. They alter neurotransmitters like dopamine, causing dependency and severe side effects such as insomnia, irritability, and memory loss. Additionally, continuous use can lead to structural changes in the prefrontal cortex, the area responsible for decision-making and impulse control. Studies indicate that individuals who use amphetamines long-term have a higher risk of developing cognitive and behavioral disorders. Consider discussing behavioral therapies with your doctor, such as cognitive behavioral therapy, which can offer effective alternatives without the risks associated with amphetamines. 2. Omeprazole. Commonly used to treat gastritis and reflux, omeprazole reduces the absorption of vitamin B12, which is essential for brain health. Vitamin B12 deficiency can lead to mental confusion and memory problems. Moreover, this vitamin plays a crucial role in maintaining the myelin sheath, which protects neurons and facilitates the transmission of nerve impulses. A lack of vitamin B12 is associated with irreversible damage to the central nervous system. Discuss natural alternatives and dietary adjustments with your doctor, such as increasing the intake of vitamin B12-rich foods like lean meats, fish, eggs, and dairy products, or supplementation under professional guidance. 3. Medications for asthma and urinary incontinence. Used to treat asthma, urinary incontinence, and other conditions, these medications block acetylcholine, a neurotransmitter vital for memory. Studies show that prolonged use can increase the risk of dementia by up to 54%. Furthermore, blocking acetylcholine disrupts communication between neurons, impairing the formation of new memories and the retrieval of stored information. Explore less aggressive options with the help of a professional, such as alternative therapies or medications that do not affect essential neurotransmitters for cognitive function. 4. Prednisone. These medications are used to treat inflammation but can alter cortisol levels, harming the hippocampus, the brain area responsible for memory. Chronic elevation of cortisol is linked to neuronal damage in the hippocampus, leading to memory and learning difficulties. Additionally, prednisone can increase the risk of diabetes and hypertension, conditions that also negatively affect brain health. Studies suggest that patients on prolonged prednisone treatment experience a reduction in hippocampal volume and impaired cognitive performance. Always follow medical advice and avoid prolonged use, seeking alternative therapies whenever possible. 5. Alprazolam. Prescribed for insomnia and anxiety, these medications have calming effects, but prolonged use can double the risk of Alzheimer's disease. They interfere with the sleep cycle, impairing memory consolidation. Quality sleep is essential for transferring short-term memories to long-term storage and for clearing neurotoxic waste from the brain. Disruptions to the sleep cycle can lead to cognitive deficits and increased oxidative stress in the brain, contributing to neurodegenerative diseases. Alternative therapies such as cognitive behavioral therapy for insomnia, CBTI, and relaxation techniques may be safer and more effective in the long term. 6. Diphenhydramine. Commonly used to treat allergies, these medications block acetylcholine, causing adverse effects on memory and increasing the risk of dementia. Additionally, diphenhydramine has anticholinergic properties that may cause confusion, especially in older adults, and heighten the likelihood of falls and bone fractures. Opt for second-generation antihistamines, such as cetirizine, which are less harmful and do not easily cross the blood-brain barrier, thereby reducing cognitive side effects. 7. Amitriptyline. These medications were widely used to treat depression, but have a strong anticholinergic effect, impairing memory and learning. Amitriptyline interferes with the transmission of nerve signals, making it harder to form and retrieve memories. Today, safer alternatives exist, such as selective serotonin reuptake inhibitors, SSRIs, which effectively treat depression with fewer cognitive side effects. Studies show that SSRIs do not significantly impact cognitive function and are better suited for patients concerned about brain health. 8. Statins. Used to control cholesterol, statins interfere with cholesterol production in the brain, affecting cognitive functions. Cholesterol is an essential component of cell membranes and neuronal synapses. Reducing cholesterol levels may compromise the integrity of neuronal membranes and disrupt communication between neurons, leading to memory and concentration issues. Although studies are contradictory, some indicating statins may help prevent dementia, others suggesting risks, it is crucial to monitor symptoms and adjust treatment with your doctor. Regular evaluations of cholesterol levels and cognitive function can help balance the benefits and risks of using statins. Each of these medications plays a role in treating specific conditions, but conscious use is essential to minimize memory